The client presents with prominence on the lower part of the sacrum on the left, and the ILA appears lower. There's blocked motion when I spring forward on the left side of the lower sacral quadrant, but there's motion here, here, and here. I can get spring mobility to translate springing under the right ILA of the sacrum, but not on this side. And some people say this is a sacral torsion and it involves twisting of the sacrum within the ilia, but no one has shown in a client the pre and post imaging to validate this. So we really don't know. I mean, it certainly could involve, and does seem to involve the facet joints of the L5-S1, possibly the L4-5 as well. If I take the whole pelvis, you know, and twist it in such a manner that it looks similarly, you can see that we're getting movement in the facets, and yet I didn't move sacrum inside the two ilia. So nonetheless, that would affect the lower lumbar joints and maybe the L4-5 lumbar facet joints as well. And that can create a felt sense of something being stuck, and that's what you described, correct?
Yes.
You described feeling like you're stuck.
Yes.
Can you point to where it feels stuck?
Right there.
Okay. And do you feel stuck anywhere else?
Kind of just in this area.
Okay. All right. And the top of the bony pelvis is up here. You have tall pelvis. Okay, that's a very tall ilium for your body type. You're very slender. I mean, not very slender, you're slender. How tall are you?
About 5'1".
About 5'1". That's a tall pelvis for a 5'1" person. You don't weigh much. What are you, 120?
About 115.
115, okay. Alrighty. So yeah, you're just by design, you have a tall pelvis. It is what it is. So you're pointing kind of to the L4-5 region approximately, okay? When you point laterally, you do have, of course, the lumbar facet joints on both sides, and in the lower thoracic, you also have rib joints. I'm springing the ribs and not feeling any particular restriction there. But when I come under the sacrum on both sides, you're lower on the left side. And when I try and get superior mobility, I can't get any movement with a reasonable amount of force. When I come onto the right side, I push and it moves a little bit. It's called taking up the slack, and then I can spring and I see your head bounce up and down, so movement easily translates all the way up. The lower sacrum is more prominent towards the ceiling. I can spring on the right side and get movement, and I come over on the left and it just doesn't give, and I'm putting double or more force on the left side. So again, we can call this a sacral torsion, but no one has validated that that's happening inside your SI joint. And if in fact the sacrum did that, we would expect some shifting to happen in the joint in the front, which is the pubic joint. And I've palpated your pubic joint and I've done passive motion testing. I don't find a restriction there. So maybe we need to rethink this thing that we call sacral torsion and look at it more from a lumbar perspective. If we put glue inside your SI joints before your injury, but you still had a twisting injury involving the whole pelvis, it would affect the lumbar facet joints without anything happening inside the SI joint. So it is what it is. The way that I treat it is I still treat it biomechanically. I try to create a superior vector. So I put some force upward, and then I create an anterior vector also. So I stack those movements and I push firmly. I'm putting about somewhere between 20 and 30 pounds of force on you, and I sustain that for up to 2 minutes. But I perceive a little bit of give, and maybe this is enough, enough force. So I think what I'll do is I'll come off of that, and then I'll come underneath, and that looks symmetrical, and I can get superior spring now, and now I'm on the lower quadrant, and I can push and load it, and I can now spring that. So that is different. Could I have you step down and walk down the hall and back? Wait just 1 second. Okay.
Walk this way?
Yep, just walk down the hall and then come back. And now I'll have you sit in the chair.
Here?
And one of the biggest problems is you don't tolerate sitting or standing for 20 minutes and you're in trouble, right?
Yeah.
And you've had a fair amount of effort with physical therapy. You saw 3 different therapists, 6 visits each.
Yeah.
And you saw 3 chiropractors.
The physical therapist, all they did was the core, strengthen your core.
Right, right.
And that, so it wasn't really whatever manipulation or anything.
Yeah, for someone saying they're stuck, I'm not quite sure how strengthening a core is going to help.
Yeah, I wasn't getting what I needed.
Right, right.
Absolutely.
And then you saw 3 different chiropractors, about 6 visits each, am I correct?
One was over the summer, and then one was just recently. So actually, I'm sorry, it was 2 chiropractors.
2 of them. You saw
Yeah.
2 of them previously, and you just started a new one.
I saw one previously, and then I was doing the physical therapy, and then I just started with a new chiropractor.
Okay, so how many times have you seen the new one?
About 5.
Okay, okay, alrighty. Okay. And you still feel stuck?
Yes.
Okay. How did you feel walking, and how do you feel sitting?
I felt a lot better walking. Sitting, I think I feel a little bit more support than I had before.
Okay. You kind of did something with your hands, indicating that maybe
Oh, it was more. I think it was a little more level.
you feel like you're more level now.
Yes.
Okay.
Yes.
And that's what your body tells me, and that's what I see when you're on your stomach. And that part of your body is made for movement. Whatever it is, whatever that mystery black box phenomenon is, it's supposed to move. It's supposed to have normal spring mobility. And when it's absent, seems to facilitate nociception, which ultimately can express itself as pain, felt pain. It's a complex process, but restoring motion can go a long way. And I see folks every week who have this pattern. And it's not getting much press. It really isn't.
No, it's getting none.
And I think people are, stating, well, the SI joint hardly moves, so you can't blame the SI joint. And I agree with that. I know what the literature says about that. And maybe it's just more of a specific type of a lumbar phenomenon, a lumbar facet phenomenon that needs our attention. And maybe we just need to change how we think about it. But tomorrow I'll teach you how to keep the motion. I don't want to give you any homework today. I want you to come back tomorrow. I predict it's still going to be moving well. And
As far as the sitting goes, how would that affect being able to sit?
Well, it would cause you to sit asymmetrically, and your body's going to try and twist to kind of accommodate that altered positioning to reduce stress on it, which ultimately is a stopgap maneuver.
So when I guess when I felt like I was sitting, I just felt like my spine wasn't able to support me. So how would this change? How would this provide that stability?
So with this pattern, and I didn't really demonstrate how motion measured at the lumbar spine was reduced, but with this pattern, when I evaluate mobility passively in the lumbar spine, it correlates. Okay, so the spinous process is that middle bony bump in the lumbar spine, and when you have this pattern, okay, that involves a twisting of pelvis and maybe of lumbar spine, then you can see it's going to stress the facet joints unevenly. It creates rotation and side bending. So when you sit, it would make sense that one side of the facet joints might be uncomfortable. And when you restore normal position, then those joints have freedom of mobility and more symmetrical weight bearing.
Yeah, I feel more symmetrical now. So I feel there's more opportunities to have more support. So it will hold me up.
Very good.
Yeah, I definitely feel a difference.
Nice, nice. And I'm just feeling you neck down because I like to include people's arm movement because that's communicating.
Yeah.
So anyway, in summary, whatever this thing is called, it may be more of a lumbar phenomenon than a phenomenon of purportedly the sacrum twisting obliquely. Yeah, more research is needed, but in the interim, we need to try and help people have less pain and become more independent. And on day 2, you'll know how to treat this yourself, and you will not have to come back and see me again to restore the movement there. That's what we do here. So thank you very much.